body. In previous lessons we have discussed about human resources management, and we have discussed main points regarding the human resources and their important role for making strategic human resources decisions. In these lessons, I am trying to set you what is the manpower planning in health and human services, as well how it can prove the importance of human resources offices like key players. As we know, health manpower is one of the most important resources for the health sector. Developing this resource is one of the most important resources, is to support health services, is a great challenges facing the health administrators today. Lack of agreement on how planning should be defined is one of the first problems. As a result, there are definitions that focus on comprehensive planning and those that aim at a specific function, social, economic, physical, as well, health and welfare planning. The question is, what is workforce planning? According to classic writers about this item, means the application of scientific methods to policy making or the application of scientific methods organized actions. The most famous classic writers about human resources manpower planning are Banfield, Davidoff, Rainier, Meyer. You have to find more information about these classic writers on the web of Unigetuno. Comprehensive planning has officially defined by the Executive Office of the President of USA, the decade of 1960, and it is, simple terms, manpower planning definition is getting the right number of people with the right skill, experience and competencies in the right jobs at the right time. These shortcut definitions cover a comprehensive process that provides managers with a framework for making staffing decisions based on organizations, strategic plan, budgetary resources, workforce competencies. All of these definitions have a number of characteristics in common. There is a crucial need to improve all the aspects of human development in any country, namely planning, production, procurement, and utilization. The people involved in the health sector, like doctors, nurses, technicians, and all the other health workers, is an important input in the production process. Is the most important factor of production and distribution of these services. The contribution is crucial to the implementation of health policy, patient care, implemented public health programs, and primary health care and management of biomedical technology. During the post-war years, some countries have a great experienced economic prosperity as expressed through the gross national product, with the growth rates were impressive. The interest of classic researchers turned to the implementation of the phenomenon, but quickly proved the inability of traditional economic theories to explain the economic development of those status based only on quantitative increase in physical capital. In this point, it was estimated that the formation of wealth health nations contribute, other than a physical capital and the human capital accumulation in the form of the spread of scientific and technological knowledge. About scientific knowledge we have discussed in previous lessons. To explain the economic development of those states based only on quantitative increases in physical capital. In this point, it was estimated that the formation of wealth nations contribute, other than physical capital and the human capital accumulation in the form of the spread of scientific and technological knowledge. The Alma Ata Declaration in 1978 was an important milestone in the struggle for health. The question is, what is the changes? First, primary health care as outlined at Alma Ata calls for three developments. The first one, universal availability of essential health care to individual families and population groups according to need. The second one, involvement of communities in planning and evaluation of such care. And the third one, an active role for other sections in health activity. Each of these developments has far-reaching applications for health services. To make essential care universally available, for example, calls for a more equitable and efficient use of health resources. The World Health Organization European region, which comprise mostly developed countries, is leading the way in this respect. World Health Organization's Division of Health Manpower Development provided the need leadership and directions for healthcare human resources development across the various regions in the world. On the other side, the national health managers have traditionally been more concerned with numerical data on finance and different activities. You can find more about the classic theorist Haynes, the paper which be published in 1995. Knowledge management in health organization, we have to know, requires careful and evaluate monitoring of care. Managerial competence in relation to information use. Competence relevant to information use will include the skills to locate, to access, to edit, to synthesize and then apply information in all clinical and medical settings. An organization must be able to link information needs to organizational objectives and to translate this into an information supply targeted to each of its staff. This may involve working with closely defined national, regional, and district strategies or company strategies in private or health public sector organizations. Identification of information needs should consider both the individual behavior differences with user groups and the patterns of information behavior among user groups. The user group in the hospital setting is physician, is the nurses, is the biologist, is the medical librarian, and all the staff health worker. As well, in the field of health organization decision making. For example, the prominent researcher O'Reilly in 1999 set out the information needs should be such as object information, such as customer requirements, activity information, such as budget, resources users, and cost in particular activities, performance data and outcomes, data relating to target set and cost effectiveness. Putting aside variations in terminology, the processes are very much alike. Health managers require information in order to plan by setting goals and developing policies, to organize by setting in place structures and procedures to ensure activities, to control by meaning performance against goals, to coordinate and communicate in order to transmit and receive information on goals, activity and performance. According to classic theorists, this makes management seem more of a science than an art. In the health service, clinical convergence, as described in 1998 in a white paper Department of Health, requires agreement to performance criteria and evidence-based practice at all levels in clinical settings. The first publications about that issue had caused strong reactions in scientific circles, particularly the use of the new term about human capital. Many organizations, both public and private, have developed models for workforce planning. Prominent researchers in the study of human capital were Schultz, Friedman, Mincer. All of those are from Chicago School of USA. All those models, based on analysis of supply analysis, this analysis presents workforce competencies in identification of competencies needed in the future. The gap analysis, a comparison of the present workforce to future needs to identify competency gap and surpluses. Demand analysis, the preparation of plans for building the workforce needed in the future. Solution analysis is the process of developing strategies of closing gaps in competencies and reduces surplus competencies. The last one, the evaluation analysis, involves a periodic and systematic review of the workforce plan, reviewing mission and objectives to assure they remain valid and making adjustments as required by changes in mission, objectives, and workforce competitions. The evaluation analysis, this process, is simply in outline, but depends on rigorous and comprehensive analysis of the organization's work, workforce and strategic direction as well.